to be doing an analysis of the chances of survival, which is probabilities, associated with specific presentation of monosomy X, which is Turner syndrome. I just wanted to give a quick trigger warning that I will be talking about miscarriage, stillbirth, pregnancy, and infant loss. I will not be showing postmortem photos, but if that is something that you guys find distressing, I just wanted to give you a heads up. If you need to sit this one out, I totally understand. I will not be offended. So just do what's right for you guys. So, just introducing monosomy X is also known as Turner syndrome, and it is a condition that affects only females. It results during the very beginning stages of development in the womb, where one of the sex chromosomes, the second X chromosomes in girls, is missing or partially missing. If it's missing in some cells or a partial deletion, it's called mosaicism or mosaic Turner syndrome. If it's missing in all the cells, a complete deletion, there's no second X chromosome, 45XO, like you imagine 46 chromosomes. If there's just 45 and then there's none, that's complete deletion of the second X chromosome, monosomy X. So mono, one, somy, monosomy X. One X, not two. So presentations for girls and women that live with TS, some of the common symptoms and presentations are short stature, cardiovascular disorders and malformations, renal failure, lymphatic problems, and infertility. Turner syndrome occurs in 1 out of every 2,500 female births. With medical care, babies with Turner syndrome can live normal lives, but unfortunately most girls affected with this disorder do not make it to birth. This is just a fun fact, something kind of sweet. In the global community, girls and women with Turners are honored by the symbol of a purple butterfly, which represents strength, perseverance, and hope, also acknowledging that most butterflies have to fly away. Here are some of the beginning statistics. Only about 1 to 3% of pregnancies in which the fetus is diagnosed with Turners will live till birth. These babies are miracles and they defy all of the odds we're going to talk about. 50% of all confirmed pregnancies that end in miscarriage are thought to be babies with Turner syndrome. And then the elective termination rate for fetuses prenatally diagnosed with certain SCAs, which is sex chromosome abnormalities, including monosomy X, is averaged to be at 76%. So we are going to be talking about a specific incidence of Turner syndrome, which is our daughter, Felicity. The fatality is definitely dependent on the extent of the deletion, and that impacts the extent of how it presents itself, or the body, how it impacts the heart and things like that. For the purpose of this project, we will analyze the probability of survival chronologically of all of Felicity's diagnosis, multiplied only by the risk we knew at the time. So we'll be going from what we first found, what the doctor said, the risks we were looking at per diagnosis of her presentations. She was diagnosed at 13 weeks of having 80% likelihood that she does have TS. It was a non-invasive prenatal testing, blood test. And so when she was born, we did find out after that she was a complete deletion. So she was 45XO in all of her cells. But again, we'll be looking at the presentations, not adding the risk associated with TS. So we're not going to start with that 1 to 3% chance. Instead, we're going to look at each of her presentations specifically. So just kind of to lay out how we're going to go through everything. So ultrasounds as well. I have some of my actual ultrasounds here, but I didn't want to blow them up on the screen because they have like names and hospitals and information. So if you guys are interested, I have some down here, but other than that, all of the pictures you're going to see of babies on ultrasound are from online. So condition A, the first sign that something wasn't right with our new baby was what looked like a big bubble on the back of her head and neck and on her back at approximately 10 weeks of gestation. So this is distinguishable as separate from the amniotic sac, which the baby is in. The sac is filled with lymphatic fluid, which is why it's also called lymphangioma, and often signifies a chromosomal inequity. We didn't know that, but it was kind of a sign that something wasn't right. And from this specific condition, the outcome of miscarriage is 77.8%. So her chances are now the 1 minus 0.778, which is 0.222 chances just after that first condition. The next condition was pleural effusion. So they found fluid around her lungs and her heart. The fluid compressed and restricted the growth of her lungs, which was really dangerous for when she would be born. She wouldn't be able to get enough oxygen. I pushed her heart from the natural place at the left side to the right side. And it's often an indicator of malformations of the heart, but again, we did not know that at this time, so we're just gonna be calculating it as if it were an isolated incident. And the prognosis as an isolated incident is good, with a greater than 90% chance of survival. So we'll say 91% just for this project. So that becomes 0.222 times 0.91 to a total of 0.20202 chances of survival. Condition C was ascites. She developed swelling in and around the organs in her abdomen, continued to compress organ growth, vital organs. It can improve as the pregnancy progresses, which is why the survival rate is 50%. If the baby is diagnosed before or less than 24 weeks gestation, we were less than. The live birth rate is only 66.6%, but we're gonna use that survival rate, that 50%, that includes before and after birth. So that was the 0.20202 times 0.50 is 0.10101 chance of survival. So high drops, condition D. Unfortunately, all of these symptoms continue to worsen to the point that Felicity developed hydrops fetalis. She now had full body edema, so swelling all over her little body. It did include conditions B and C that we already discussed. So we're not wanting to double count those risks, so we're actually going to take them out. The cystic hygroma condition A is a risk of its own, but B and C are part of D, so we're going to take them out at this point. Hydrops includes the ascites, that abdominal cavity swelling, that pericardial effusion around the heart and around the lungs, the pleural effusion, and then the generalized edema that we saw at this point, also known as anasarca. So only about 20% of babies will survive both. So we're now going to multiply the chances of the first condition, taking out conditions B and C that become condition D. So 0.222 times 0.20 is now 0.0444 chance of survival. So these ones, conditions EA and conditions EB. Muir syndrome, unfortunately, in up to 15% of pregnancies where hydrops develops, there is now a risk to the mother called Valentin syndrome. We'll call this condition EA. If this condition develops, the only treatment is immediately delivering that child prematurely. It can cause seizures and extreme hypertension, kind of like preeclampsia in the mothers, so it is extremely life-threatening. And if that develops, then you have to deliver the child. So if condition EA, then condition EB, which is obviously we're looking at the very premature delivery of a child. I looked at 25 weeks of an otherwise healthy child, which is 50% survival rate, multiplied by the risks we already know of. So if condition EA occurs, 0.0444 times 0.50 is 0.0222. And if the condition does not occur, our chances remain at that 0.0444 chance of survival. So we really suspected something was wrong with Felicity's heart just because of all of the other presentations, but this is the point at which we found out what was wrong. We were hoping for the lesser of the conditions, which is a coarcted aorta associated with Turner syndrome. It was revealed in an echo procedure of her heart, which was only the size of a nickel at the time, that she did in fact have hypoplasia of her left heart, HLHS. We were told that the left ventricle of her heart was almost non-existent. This condition has a good prognosis for a pregnancy continuing, as the mother's heart provides the oxygen the baby needs through the placenta and the umbilical cord, but unfortunately, 91% of infants with HLHS will die within the first 30 days after birth. So her chances of survival, again, broken down into if the Muir syndrome occurred and we had to deliver prematurely. So if it occurs, we have that 0.222 times the 9%, equaling 0.001998% of survival, or probability of survival. And if it does not occur, we have the 0.0444 times the 9% is the 0.003996 probability of survival. after condition F. Condition G, growth restriction. So by 17 weeks, her body was unable to continue growing due to the pressure and extent of her swelling and heart failure. This condition can sometimes improve on its own, it seems kind of random that it does that. On all the studies I looked at trying to find some good stats, it seems kind of random when it does and when it doesn't improve. But it can also be a sign, one of the first signs of impending miscarriage, or IUFD, intrauterine fetal demise, which is stillbirth. As an isolated incident, survival and fetal growth restriction pregnancies diagnosed before 32 weeks is 81%. So that was where we were at too. So we were before 32 weeks. So now her chances of survival, again, broken down into if E, EB, if and only if EA. Condition EA occurs, that's 0.001998 times 0.81. Now is that 0.00161838 probability of survival. And if it does not occur, that 0.003996 times 0.81 is now looking at a 0.00323676, slightly better chances of survival. So agenesis of the ductus venosus is a pretty rare finding, actually. One of the things we found out at Children's Denver when we went to see what they could do to help her. It's an umbilical vessel that's pretty important in the umbilical cord. They showed us where that should be, and they said that it wasn't there, and that she was getting oxygen obviously somehow, but that we just actually don't know how. So it's really incredible that without a heart condition, this is surprisingly 75% positive outcome on its own. Obviously, because we don't want to double count those other risks, we're going to use it as if it were an isolated incident and then multiply it by the risks we have already accounted for. So now we have, if it occurs, 0.00121378.5, and if it does not occur, the premature risk, 0.00242757. Again, a slightly better chance. Amnion chorion separation, so condition I. Lastly, at Children's Hospital, we hope to receive intrauterine surgery to be able to improve her chances of survival. We're hoping they could do just some really incredible things, if you guys want to look into it later, to actually increase those chances that she would make it. They can expand her heart as small as her heart was the size of a nickel. They have a procedure where they put a little balloon in there and try to blow up that ventricle, get it to develop. So we were seeking this surgery with the best doctors in the regions at Children's Colorado. But unfortunately, this condition where the amniotic sac, where she is, failed to seal to the chorion around her, made it impossible to provide any intrauterine intervention. And so we could not get any intrauterine surgery for her. To give her the best chance, we needed to just let her grow as much as she could so that post-birth surgeries could happen. The separation before 14 weeks is normal, but after 16 weeks is very uncommon and usually a sign that something's really, really wrong, which we of course know is the Turner syndrome diagnosis, the full deletion. So this on its own doesn't have any other risk except for that EB possibility we've already talked about, the premature risk. But it does stop us from increasing the chances of her survival. So now the chances of increasing the chances of survival, the probability is 0. So here's a summary, guys. It has all of the conditions from A through I. Again, we did take out B and C because they combined into D. So we then just counted that probability. Going down, we did have this condition, which did not occur. So in our instance, our specific situation, I did not develop Muir syndrome, which is that life-threatening hypotension disorder, which would have led to her premature delivery. So we do not need to add that into our final equation where we are looking at just her situation. Again, condition I, no additional risk, but brings the possibility of increasing chances of survival to 0. So her survival chances rounded to the 5th decimal place is, with all of her TS presentations, she had an approximate survival probability of 0.000243. So pretty low for baby girl. We did make the decision to carry to term, or to the natural end of our daughter's life. Felicity passed away due to her TS symptoms and was stillborn at the gestational age of 20 weeks and 5 days on June 6, 2023. She was 9 inches, little baby. I have her little footprints up here if you guys wanted to see. She's buried at Evergreen Cemetery next to her brother, who we lost at 7 months to unknown and unrelated causes. So, carrying to term, just some quick statistics on this, is that obviously staying pregnant full 9 months or until a baby is ready to be born. The phrase has also come to mean the choice to continue a pregnancy with a terminal fetal diagnosis, such as Turner syndrome. So 37%, that is the percentage of time when a genetic counselor even mentions continuation as a possibility, as an option for a pregnancy with a terminal diagnosis. A 2015 Duke University study showed that women who continue their terminal pregnancies generally experience less psychiatric distress than those who do not, even after loss. So I did link that study, and I know it's a sensitive topic, but if you guys are interested, I have that information available. Felicity's middle name is Leyland, which means flower of hope. She wanted to fight, we wanted to give her that tiny, tiny chance. She still had it. It wasn't 0.000 infinite. She had that chance, and we were going to be there to fight with her. I'll never regret the months I carried that fear, because I also carried her. I'm 100% glad that I chose to meet her. If you've lost a pregnancy for any reason, it is 100% possible, the probability is 100% that you can heal. And there's lots of resources available, including perinatal trauma counseling, which has helped me personally. Felicity and Theo's little sister is due on October 2nd. Little girl, she does not have any presentations of TS, appears to be healthy. And at 15 weeks and with no current complications, baby sister has a greater than 99% chance of making it into our world. Here are my references, lots of references, and some resources if you guys are interested. Thank you.